I'm Jonathan Ferencz. I'm a prosthodontist from New York City, and I'm here to share with you a couple of tips that have really impacted the way I practice dentistry. And both of them have been influenced by CAD/CAM. So CAD/CAM has really changed the way in which we treat patients. So the first tip that I'd like to give you, if you're contemplating investing in CAD/CAM and becoming a user and using it more effectively, is that a scan, an intraoral scan, and we use the Trios by 3Shape, is part of every consultation. Every new patient visit starts with x-rays if the patient has not brought them, doesn't have them from their first provider. So we've got some radiographs, but there's always a scan. And what do I do with this scan? Well, we get the patient out of the chair and we turn them around and they actually look at a scan of their teeth. And we do it for a number of reasons. One, they see things in their mouth that they could never see with a mouth mirror, with a hand mirror that dentists are comfortable using. They can see their teeth and their oral structures from views that could never be done before. So I can turn the scan around and they can see what their teeth look like from the lingual, from the occlusal. So once we look at this scan together, and the comments that I get from patients are always positive. They are so impressed with this technology. So what we look at is really their chief complaint, and it's most appropriate or most helpful in anterior cases. So we look at the patient's anterior teeth. I understand what their complaint is, what their consultation is all about, and then I bring in one of the technicians. And we do a digital diagnostic. We use the term wax up, but it's not a wax up. It's a digital diagnostic design. And this design is done with 4 of us present. So there's the technician, the patient, myself, and my role is to make sure that the technician doesn't do something that I can't do clinically with the computer. And then there's the dental assistant who really serves as the patient's advocate. So the 4 of us are huddled around the screen, and it's really quite simple. We just say to a patient, everything that you see in gray is what your teeth look like today. And anything you see in white is our proposed change. And what I find is that patients really get it. I used to think that they understood diagnostic wax-ups. I would ask them if they understood. They would always shake their head. And as soon as I would leave the room, they would turn around and ask my assistant, are my teeth going to be green because we use green wax or blue wax? So it really became apparent to me that this standby that we taught dental students for 50 years doesn't really work for patients. But an intraoral scan really does work for patients. Has it helped us? It has dramatically increased case acceptance. So I'm happy to share this tip with you today that really has changed the way we practice and has influenced our success, the number of patients who accept treatment, and the quality of life in our practice.